I'm Dr. Jennifer Scoles. For those of you, there's some guests here that I don't know. Thanks for being here tonight. We've been here in Knoxville for about 16 years now. My husband is Dr. Andy. You've met some of our team, all of us in the red shirts. So we're going to be talking a little bit tonight. Dr. Andy will be talking a little bit, and then our guest speaker tonight is Dr. Joe Smith, and he's from Dreyer PT. How many of you have already been talking to Joe tonight? Yeah. And he's already been answering a lot of questions. So they've been here in Carnes for about 18 months, but their Dreyer PT has been around for about 20 years. In what state did you say they started?
Maryland.
In Maryland. So they've been in Tennessee for about 7 years, but here in the Carnes community just for 18 months. So we're excited to have them. We've referred lots of practice members down to see them. Dr. Andy will kind of explain how chiropractic and physical therapy go well together. I love their principles though. When he first came down to meet with us when they moved to Carnes, he gave us his guiding principles. The first one listed as perspective, and that's God, family, and work. And I like that. Our motto in our office is we move the bone, God does the healing. So our two practices join together with that common mission. Integrity, compassion, respect, teamwork, empowerment, focus, performance, and self-development. Those are all great things for a company right there. So we're so excited to have him here with us. Dr. Andy's going to start, and then Dr. Joe will finish after that, okay?
Hey guys, how's everybody? All right, well I just wanted to just talk for like 5 minutes and just talk a little bit about the anatomy of the low back and what goes on down in there. This spine is showing everything from the skull down the vertebrae, down here to the low back and the pelvis. What happens is a lot of what you can't see on my model. These are the bones, the nerves, and the discs. What you can't see are the ligaments and muscles, all the soft tissue stuff that is surrounding these bones. You've got some really large ligaments that attach between these bones, hold everything together. You got muscles, you have tendons that go across these joints. So there's a lot going on in there that can pull things out of alignment, can twist things, can get inflamed themselves and cause problems. So doing stretching, doing exercises can help to relieve some of those issues. It can take some of that pressure off of there. And it makes, if you're a patient of ours, it makes your adjustments hold a lot better if you don't have a tight muscle on one side or the other that's pulling you out of alignment. So it's important to keep flexible, keep stretched, keep things functioning the way that they're supposed to. With physical therapy and chiropractic, it really works well hand in hand because you guys, the physical therapists, they work well at getting mobility in the muscles, getting those muscles to stretch, getting joints to start moving properly again, getting the ligaments to loosen up if need be, or if they're too lax, getting them tightened up. And then with chiropractic, we adjust the vertebrae back into alignment to get the pressure off of these nerves. So that's how we work pretty well hand in hand. One of our common missions, I would say, also is to try to fix problems rather than just masking them. That's what most people will try to do when they have an ache or pain. You know, their first reflex is to maybe run to the drugstore, buy some over-the-counter pain medication, take that, try to mask the symptoms. In most cases, that's probably going to end up doing more harm than good. Because if you think about it, what if you're driving down Oak Ridge Highway and your check engine light comes on, the oil light, because your car's out of oil? You don't want to just pull out a roll of duct tape, rip off a piece and stick it over the light, right? That'd be masking the symptom. You wouldn't see that light anymore. But if you did that for too long, your car's going to blow up. It's not going to function the way that it's supposed to. So it's a lot better if we can find the cause of the problem, correct that, and then the symptoms are going to go away. With the low back pain, a lot of times the pain that you're feeling can be associated with those muscles, with those discs, things like that. But there's a lot more that the nerves have to do as well. They don't just feel pain. Very few of your nerves actually feel pain. There's nerves coming out of your low back that go to your digestive organs, especially your intestines. So if those get pinched, we've had cases of people with, they come in for low back pain, but they also have things like irritable bowel syndrome, chronic constipation, diarrhea, and those things go away as we start to get the pressure off those nerves. Reproductive issues even, because we've got nerves going down there to the reproductive organs. And then pain down the legs. You've probably heard of sciatic pain going down the backs of the legs. The sciatic nerve starts in the low back and has to go through the low back, down through the pelvis, down into your legs. So those are all things that we see a lot in our office that are dealing with low back being out of alignment. So I'm going to turn it over to Dr. Smith. He's going to go over some things, some stretches with you, and we'll stick around too if you have any questions afterward. One thing I do want to say before we all conclude is I know not everybody here is a patient in our office, and I know you guys aren't all patients at Dreyer either, so I appreciate you being here. One thing we always do for community events is we like to give you a special offer where you can come into our office and get started up just to see if you have any issues, anything going on. We use some pretty cool technology. It was invented by NASA for astronauts coming back from space station missions. It uses infrared camera, and it uses a muscle sensor to tell if you have any tight muscles throughout your spine. Normally it's a $75 test, but for any of you that are here tonight, you can have that test for free. We'll do that for you, and we'll determine if there are any issues that need to be dealt with. In order to do that, though, one of the things that a great doctor once taught me is that procrastination is the thief of all health. So if you want to take advantage of that offer, you need to talk to one of us in the red shirt before you leave tonight, and just give us your name and your contact info, and we'll get you signed up for that. All right, Dr. Smith?
Great, thank you. First thing I want to do is just thank Dr. Amy, Dr. Jennifer.